If you want to go from this to this and you want to have hair like this, which you have after 1 year forever, like you want to sport your head full of hair for a long period of time, but you have seen decreased density of people after a hair transplant and so you are in doubt. We will see 5 factors upon which the density of your hair post-transplant depends. Listen carefully and see which factor applies to you. Now, ideally speaking, the life of hair at the donor site should equal to the life of hair at the recipient site when it is transplanted in your front or mid-scalp area. But does that happen? If not, what are those 5 factors on which the life of your transplanted hair will depend? Let us discuss today. If by any chance you have lost your hair post-hair transplant, or you feel you may lose your hair post-hair transplant, please don't lose heart. Please don't feel depressed. I'll guide you what all we can do if at all this happens. Please subscribe to this channel and welcome to this talk. Number 1 is, if your transplanted hairs have not been taken from safe donor area, you are likely to lose them in due course of time. How this happens? Safe donor area grafts usually do not thin out or shed off by the DHT hormone in your body. On the other hand, if the harvesting has been done from above or below the safe donor area, you are likely to lose these hairs within a short span of time. How do we find it out? How do we find the safe donor area for you? We do take help of trichoscopy. Sometimes we also ask the patients to shave off their head a week or 10 days before the procedure. Now, the grafts, the hairs which grow out maximum are from the safe donor area. Please press the like button and we move on to point number 2. If you're not completely bald, you still have persistent hair in the area where you want hair transplant, the doctor will definitely try to preserve all the hair you have. These persistent hairs need proper care and medication in order to remain in their place. Otherwise, they will also get thinned out and shed off from their place. You are requested to take proper care and medication post hair transplant so that these persistent hairs remain persistent and the density of your recipient area remains good. So in order to be better, keep on taking the medication and take good post-op care as instructed by your doctor. If you have any of your story to tell, do not hesitate to write in the comment section below. Of late, there have been various case reports. We have found out that there are various factors apart from the male pattern hair loss which are present in the balding scalp just with the male pattern hair loss. It can be alopecia areata incognito or FAPD, which is fibrosing alopecia of pattern distribution. The way to find out is taking biopsy. Biopsy is a small tissue which we take out from the scalp and send it to the histopathologist who tells us what the problem is. But the problem is we cannot keep on taking biopsies from different regions of the scalp. At the maximum, we can take 2 or 3. But if it is not taken from the problem area, which is very difficult to find out, even in spite of trichoscopies and dermoscopies, there are chances that we are not able to find out the problematic area of alopecia areata incognito. In those cases, you are likely to have a decreased hair growth. Number 4, a lot depends on your quality of grafts at the donor area. If the requirement of grafts is same for 2 patients, even then, the result may not be the same. The quality may be thinner in one patient, thicker in another. The number of hairs coming out of a single follicle may be less in one and more in the other. Likewise, there will be a difference in the result post-hair transplant. If you want to find out how you would look after your hair transplant, even before undergoing the surgery, you can take help of Saraswat Hospital App PeekAI feature in very quick 3 steps. Download the Saraswat Hospital App, click on the PeekAI feature and upload your pictures. You will receive the probable results within 24 to 48 hours. For a detailed analysis of 7 reasons why your hair transplant can fail, you can click on the link above. In a recent conference in CAS, it was suggested that the recipient site also is a factor for growth of donor hair. So ideally, the donor hair should grow in the same quality as on the recipient side. But then the recipient side skin has its influence on the grafts and therefore it may change the texture or the thickness of your grafts. Nothing much can be done for it. So you have to take a good post-transplant care. This is the only thing you can do as for this factor. As I mentioned initially in the talk, let me now discuss what all you can do if there is a problem of scalp show after your hair transplant. When you see your hair doctor again, after you feel that the scalp show has increased, probably they will do your trichoscopy again and then sit down to discuss. There are a few things which can be done. First of all, they'll see if you're taking your medication properly or not. They can suggest a few therapies to you like PRP therapy, growth factor therapy and so on. And also, there is something called scalp micropigmentation which can help you. It can decrease the scalp show, though it will not give any volume to you, but it can always help you in decreasing the scalp show. And if you have sufficient hair to comb over, there is a win-win situation without surgery. Sometimes a second hair transplant may be needed depending upon which factor is there prevalent for you. So if you want to understand better, do see all the factors again. Share this video with somebody who is still skeptical about hair transplant results. If you want to see a recent hair transplant testimonial video, please click the link on the left. And if you want to know about the cost of hair transplant, please click the link on the right.